It's now time for Ask the Derm. Board-certified dermatologist Dr. Groff from Cosmetic Laser Dermatology here to answer all of your skin questions. Dr. Groff, good morning. Always good to see you. Oh, this is going to be some good stuff, especially with the weather right now.
Oh, yeah.
All right, let's get to the first question. This is from Sheila. Sheila says, I have excessive underarm sweating and have tried multiple home remedies that have all failed. Can you please help me?
So you can see, especially given, like you said, the weather recently with all the heat, patients that suffer from hyperhidrosis, which is excessive sweating, are really having a hard time. So one of the things that we've been doing the past few years is we use Botox, which will completely shut down the sweating, but there's a newer technology, it's called ThermiDry.
ThermiDry?
Yes.
Okay.
So what that involves is what we do is we inject Novocaine into the underarm area and make it completely numb. Then we use this probe. Now
that looks kind of scary.
This probe normally would be attached to a machine that generates radio frequency. So once the underarm's numb, we can slip this probe under the skin and deliver radio frequency to the glands that produce sweat.
Oh, wow.
And it shuts them down. And it can last for 3 years or longer. So one treatment, 3 years or longer, no sweating and no body odor.
What is that called again?
It's called ThermiDry.
ThermiDry. Okay,
yes.
Sheila from Chula Vista. I hope that answers your question. Let's get to the second one. This is from Terry in Encinitas. My son has this bump on his lip. Can you tell me what this is and how to treat it? Thank you, Dr. Groff.
Oh.
What is that?
Well, you can see if you look closely, he's got a little red growth on his lower lip, and kids commonly get these. These are little what are called angiomas. They're little dilated capillaries at the surface of the skin, and I believe we might have a before and after photo. These are easily treatable, they're harmless, and usually with 1 or 2 zaps of the appropriate laser, we can get rid of these. So if it's cosmetically annoying, or sometimes they tend to bleed if they're rubbed or scratched, so it's a good idea to treat them.
Okay, this is from Aaron in San Diego. Dr. Groff, my husband has had this cyst on his knee for a number of years. What is it and how can we get rid of it?
Let's take a look.
There it is. That's the, whoa,
wow.
That's a big cyst, huh?
Yeah, that looks like that's probably a couple inches across. This is what's called an epidermal cyst. Now, Shali, I don't know if you've ever been on YouTube or Facebook and people post videos of popping these cysts or, you know.
Oh, yeah, I've seen it. I can watch those all day.
So, and they're doing it at home, which is a big no-no.
Yeah.
The problem with that is, imagine this is the cyst under your skin, okay? So you're at home and you decide you're going to try to release this cyst. So what happens if I can, oh, there we go. So we release the contents of the cyst, but the cyst stays under the skin. So this cyst wall has to be removed or it'll just keep coming back and back and back. So you got to go to your doctor's office to take care of this.
Okay, this is from Monica in Chula Vista. Monica said, Dr. Groff, I recently tattooed my eyeliner, which I did not give it much thought. What is the best way to remove considering it's by my eyes? It's from Aaron in San Diego. Or no, Monica, Chula Vista. Well,
yeah, I see this all the time. Women get their eyeliner tattooed or their eyebrows, and then they hate it. So the good news is with the newest laser technologies for treating tattoos, we can treat these just like we would a traditional tattoo art on your arm or back or anywhere. So you can see this is a patient of mine that I just did one treatment on. See how the eyeliner's probably like 90% going with this one treatment. See how it swings out from her eye there, and then in the after photo, it's much, much better. So we can definitely treat these, even though they're close to the eye, no problem.
Okay, and then this final question. This will apply to a lot of us. Me too, Dr. Groff.
Me
with
too,
the recent changes to the weather, my nose is really dry and cracked with occasional bleeding. What is the best way to treat this? Just with all the dryness right now, Dr. Groff.
Yeah, you can't really see in this photo that he sent us, but I mean, we've all experienced this. With the dry weather, the inside of the nose gets cracked, it gets sore, it can bleed, it feels like there's scabs in there. So forget all the home remedies and all the tricks online. The simplest thing to use is good old Aquaphor.
Oh, I know this stuff.
Yeah. So you just take a tiny bit and put it on your pinky or your little finger, and then just go inside the nose and just put a nice thin, even layer. And really within a matter of just a day or two, you see a huge difference.
That quick?
Oh, yeah.
Perfect.
You can do it a few times a day. You don't want to put too much in there, just a nice, thin, even layer. And it works miracles. I use it myself when I have that problem.
Perfect.
So it's great.
Well, Dr. Groff, thank you for being here. Always good information. If you want to get in touch with Dr. Groff, the info right there on the screen. We've also linked it to our website for you. 9:12, Raul, we'll get it back over to you.